So Stasia is going to talk about low socioeconomic individuals who she works with. She works with the youth community, and I'm going to give her a chance to tell us a little bit more about the unique needs of these individuals. But before we get started, Stasia is going to go ahead and just introduce herself.
My name is Stasia. I was born and raised in Albuquerque, New Mexico. I studied psychology at the University of New Mexico, and I currently work at a nonprofit called New Day Youth and Family Services here in Albuquerque. I've worked in various nonprofits in New Mexico in the education, healthcare, and social service industries. And the demographic I work with currently is underserved youth ages 12 to 24. So this includes youth in like recovery facilities, group homes, youth in the foster care system, homeless and incarcerated young men and women.
Okay. So we're just going to get started asking a couple questions. Our goal is just to kind of get to the unique needs of this group of people. We'll start with the first question of what are some unique healthcare needs that you often come across while working with youth who have low socioeconomic status that you feel healthcare providers should be aware of?
All right, so yeah, in thinking about this question, something that is unique to this demographic that I specifically work with is that they have experienced some type of trauma previously in their life that they're usually carrying, and kind of typically why maybe they're acting out or using our services. So these traumas could have been abuse, like physical, emotional, or sexual, neglect, physical and emotional neglect growing up, and also challenges within their household. So they may have grown up in families where they experience maybe their parents being incarcerated, like going to jail or prison, mental illness, substance use, or domestic violence. So specifically the population I work with, they're involved in the foster care system, so, or like the criminal justice system. So interestingly enough, neglect of emotional needs can manifest in unexplained physical symptoms. So like what we're noticing quite a bit in our safe home are youth experiencing like GI problems or like discomfort just because of these traumas. So I know they keep like a big thing of Tums in the safe home just for these youth who just are uncomfortable. And so also with these physical symptoms, they have increased medical issues such as like asthma, skin problems, or autoimmune disorders. So even though maybe they're not allergic to something, they're still experiencing these physical symptoms because of that trauma. So I think it's really important to just be aware of that can be an underlying factor, to their medical needs, maybe asking those questions. So for our intake process, when we get youth into the safe home, they take an ACEs assessment. So that's Adverse Childhood Experience Assessments. And these screenings evaluate children and adults for adverse experiences before the age of 18. So it really helps us to understand their behaviors and the challenges that they've faced growing up.
Did not know that. That's good to know.
Yeah, I know. I didn't either until I started working with this group. So I try to think about that more, when you're listening to one of the youth like talk about their experiences, and you're like, oh, why are they like causing so much trouble? Well, there's a lot of things that they probably witnessed at a younger age that lead into that. So.
Okay, so the next question we have is, how do you feel healthcare providers can better address these needs within their treatment sessions? So anytime you're working with someone from this population, how do you think they can help their situation a little bit better?
Yeah. Kind of going back to being trauma informed, I'm not sure, and I think it kind of has to be part of like the training that medical students go through, is like being trauma informed. And like I said, just thinking about that before just assuming they're like, you know, a bad kid or things like that. Kind of from what I understand, adverse childhood experiences are associated with some of the most common and serious health conditions we face today. So like 9 out of the 10 leading causes of death in the United States can be from these adverse childhood experiences. So identifying that history of trauma and responding with that specific type of care can improve the health and well-being of the individuals and the families, and lower those health costs that they face. So a simple way to kind of look at trauma-informed care is shifting the focus from what's wrong with you to what happened to you. It can offer the patients an opportunity to engage more fully in their healthcare and develop a trusting relationship with their provider, and improve their long-term health outcomes. It can also help reduce burnout among you all, the healthcare providers, potentially reducing the staff turnover. So personally, this being my first year working with this specific demographic, being trauma-informed really helps me to not be as judgmental of the decisions that these young people are making, and allows me to give them more grace and meet them where they're at, rather than saying, oh, you should be living this way. Like, why are you doing this to yourself? Because they have that trauma that it's in their body, you know, it becomes a part of you. And until that's kind of addressed, it's very hard for them to make those positive decisions. So.
Right. So just getting down to the root of the issue more so.
Yeah. And if you're trauma informed, you know, like you can see that, but I feel like those who aren't are very judgmental of it. Right. And, you know, we've all been there. So that's just something to think about, I think.
Yeah, it is good to keep that in mind. Moving on to the next question. Have you or a coworker come across a member of the youth who faced discrimination in healthcare because of their low socioeconomic status?
Yes, I have. And so I have kind of two examples of that. Earlier, talking to one of my coworkers, I asked her this question, and she was a life skills coach. So basically, she works with youth who maybe want to reach certain goals in their life, and she kind of is their mentor and kind of helps them to do that. But this specific individual she was working with was a young expecting parent, and she's also African American. So in working with this specific youth, she was telling me that she had the youth had a lot of pregnancy anxiety, and she'd tell the doctor about it, and then the doctor gave her a medication and she didn't want to take it. So kind of just like, rather than I don't know, like going over, you know, the importance of maybe taking the medication, or like understanding why she might not want to take that medication, kind of just like, here you go, this will fix it type of thing. And from what I understand, Black women have a lot of racial discrimination with their prenatal care, and not paying attention to the high morbidity rate for Black women's children. So what this life skills coach did was just help her with like coping skills to not have the anxiety. And she just wasn't happy with the care she was getting from the doctor. She didn't feel like she was being listened to. And she eventually kind of started noticing that that discrimination. Another one was for me, I worked in an inpatient hospital setting, and there are oftentimes I worked with therapists who were so just burnt out and jaded, they fail to see like the homeless or the mentally ill or the addicts deserving of the best care. So like, for example, you know, you have your list of patients that you go see for the day, and there's maybe like a prominent member of society in the hospital that day, and they're like, oh, you got to see this person, make sure you treat them good, and they're like, you know, on their best behavior with that patient specifically. And then you have another person on that list who has a whole long history of medical problems, and you know, you can look at their chart, you know, in their files and see like, you know, all of their history, and maybe they were an addict or something, and they just didn't treat them like humans. You know, they just kind of went in there and moved them around a little bit, didn't really interact with them, and like, just like I said, treat them like a human and like give them that care that they were giving that other person. And so I did see a lot of discrimination against those that might have like a lower socioeconomic status. So like the best therapists I've seen go in, like they accomplish something with them, and might be pretty small, but they were able to meet the patient where they're at that day, regardless of their mental capacity or their social status. So it's just kind of being like socially aware, and not, you know, making judgments of somebody. It kind of creates a lack of trust when they're treated that way. Yes. Another thing that kind of comes to mind is like with our youth that we work with, they get labeled a lot as like bad kids. And so they, a lot of the time, like they, you know, say they're like in foster care or something like that. They don't get that emotional, they don't get their emotional needs met because maybe they're being like moved from house to house, and they just kind of lose out on that emotional need. And so when they go to the doctor and, you know, they're checking them out and like very interested in them, they almost start wanting to go to the doctor more often because they're getting that attention that they haven't gotten. And so that's not good either, because, you know, then when are they, when is it real and when is it not real, you know? And so they are getting that emotional need met, but that's all they know how to do. That's the only way they know how to do it. So
I've never thought about it that way.
Yeah.
But that's, that's when, okay. So that was very insightful. I appreciate that. And the next question, how do you feel having a low socioeconomic status affects their access to healthcare? So just basically what's available to them and how that differs.
Okay, so most of the time they're limited to the insurance they have, which is Medicaid. So that limits where they're seeing the services they can get, what they're eligible for, and then say they have like a very serious problem. Well, usually that requires some type of prior authorization from your insurance company. And if you have a young person who maybe is emancipated from their parents, or maybe their parents are incarcerated, they might eventually give up on like pursuing getting that health need met, because it's just such a long process, and they don't know how to, or they don't know how to do it, so they don't have that education. So yeah, like their limitations, I guess, in you know, the insurance they have, and then also their overall access to the healthcare as well. So say a young person has been in like the foster care system all their lives without a stable home and family, their daily routines, their diet, mental health, dental, they're going to be kind of erratic. So by the time they become teenagers, they're going to miss those crucial health exams that a child growing up in a stable home gets. So also like, say they don't have parents, or, you know, they're living in a group home, they've run away, they might not know about the health problems that run in their family too. So simple things like going to the dentist, learning how to take care of yourself really affect the outcome of how healthy someone is going to end up.
Yeah.
The education isn't readily available either. So their development can be affected because they're going to have more health problems like chronic illnesses as they get older. They include higher likelihood of being sedentary, higher body mass index for adolescents, probably because like a lack of neighborhood resources. And then they're not like easily accessible healthy food options for them. They're kind of just like, you know, scraping for what they can afford or what they can find. There's also like higher levels of obesity and cardiovascular diseases. So, you know, this kind of goes back to what I was saying earlier of like, they have firsthand experience of the systems and the way they work. It's a mistrust in how like our system is set up, and they learn how to maneuver the system too after that. So like, you know, if they're getting prescription drugs and things like that, like they're gonna figure those things out, you know? So, yeah.
So you're kind of just saying it starts from a young age where they don't have the access to get to these things, and then they turn into bigger health risks as they get older.
Exactly. Okay. And think about like another thing we kind of talked about today too with my when my coworkers is like, think about braces, and like say you have a young person who like goes to the dentist and gets braces put on, and maybe they run away from home and then they just have these braces, and like, you know, that requires like you to go to the dentist like regularly to get checked on, and then you end up with like, you know, in the safe home, they end up with these young people who just have braces and don't know, like they've had them for years because they don't have that access, so they don't know what to do to like take care of themselves. So it's pretty interesting.
Yeah, that is. And I think it's a lot of things that we maybe take for granted sometimes.
All the time.
So when you say, I mean, we kind of touched on this a little bit, but how do you feel that this impacts their development? I mean, you kind of, if you just want to reiterate, because I know we kind of talked about it a little bit already.
Yeah, for sure. So I think it impacts their development. You know, they lose the trust in the healthcare system and the doctors. And then also, they're going to have like a higher likelihood of having those chronic illnesses if they're not getting that adequate care when they're younger. So just, you know, you like start seeing more of those chronic illnesses showing through if they don't know how to take care of themselves and they've never had that access to it, or they're limited to the types of care they can receive. Yeah. So I don't know, like personally, I work in like the Life Skills Academy, and we have different community partners who come in and teach them these life skills like I'm explaining now that are missing. So we're really trying to get the points across to them, like you have to learn to advocate for yourself and take care of yourself. And we're aiming to teach them these skills so they don't, you know, they don't have these problems when they get older.
Yeah, that is good, because they don't have that same access to learning about them as, you know, you and I, or some, you know, that's, well, I believe
sometimes
that, go ahead.
Sometimes all they have too is like social workers or, you know, different people who can help them with that. We're just kind of another piece of that puzzle for them and supporting them, rather than they have the parole officers, they have the social workers to tell them what to do. We're more on the side of like we know they know what they need to do. Some of them choose not to do it, but we're still going to be there for them, and we're still going to be consistent in their lives, because a lot of the time they're missing that. So that's the overall goal of New Days. Like I said earlier, just meeting them where they're at and not judging, not being judgmental, giving them grace, because we know it's not easy growing up, and they face challenges that, you know, we've never faced before. Maybe some of the coworkers I work with, you know, have experienced these types of things, but personally I haven't. And so it's really just being that extra, you know, support system for them.
It sounds like you guys are a really good resource for them, and
and the community.
It's impressive what you do. Yeah, I think it's definitely an important role that you guys play. So.
Particularly, like I mentioned earlier, I work in the Life Skills Academy. So I arrange classes for our youth to take that can help them in life. So there's a young person, he was actually in the juvenile detention center, and he had been there about 4 years. So we're really not sure what he did. Like a lot of the times we don't really ask, you know, they just, they hear about what we offer and they show up, and we kind of just go from there. And so, yeah, this young man, I think he's about to turn 21 now, but he showed up to one of our classes and just like super respectful, engaging, you know, he was very polite, and you don't get that a lot with, you know, like teenagers. So he stuck out, you know, in our classes. And so he would show up to our classes pretty regularly, and eventually it came time that he was going to be released, or he was up for early release with his parole hearing. So we wanted to get involved and help him, help advocate for him, I guess, and kind of like just give our account of like how much progress we've seen him make. So he started going to these classes in October, and this parole hearing was just in February. So a couple of us wrote like letters of recommendation for him of just like how we've seen him grow. And so one of our life skills coaches was able to go to his parole hearing and kind of advocate for him. And he also applied to our transitional living program. And so what that basically is like it helps youth 17 to 22, I believe, who are like, maybe they were in juvenile detention and they can't go home because it's a really bad situation at home. So we provide housing for them. And so he applied to that program. So he kind of had a place to go if he got out of juvenile detention. And so we were able to advocate for him. He ended up, you know, being released, and which is a huge deal, you know, and like, it was kind of interesting to me to like advocate for someone like that, because I didn't know what he had done, you know, but I do know, and I did see his improvements like over the past few months. So he did get released, got into the transitional living program, and then he's also in our internship. So we have an internship for youth who it's like a first jobs opportunity. So maybe they haven't been able to hold a job before, or they've never had a job, and we give them like the experience to create a resume. They get their food handler certificate, and then we teach them like just different kitchen skills. So maybe they can go get a job at a restaurant or something like that. So yeah, he's taken advantage of all of our programs, and you know, he's fresh out right now, and we're just like supporting him the best that we can. But it's just like an example of someone who, you know, is persistent enough to like make the changes in their life and trust us, and like kind of how that collaboration can work together and improve someone's life, rather than him just, you know, if he hadn't been taking our classes and like been involved in our program, what does he do after juvie? You know, does he just like go to the streets and like go back to what he knows, or does he have like a strong support system who can like just make sure he's doing the right things and kind of guiding him, you know, back into life, because he's been there since he was 16. So like missing that that part of your life, like not being out in society, you need that help to do the right things and to live a good life. So yeah, that's just one of the many success stories. I know there's a lot more that that we could share, but me being here just a short amount of time, like that's someone that I've seen just like thrive with our program.
Good. So I think that was very helpful, and it kind of gives us an idea of what healthcare providers need to consider when working with a certain population. And I would have never known this stuff had you not shared it. So I appreciate it. And I hope that someone out there can find it useful and apply it. So yeah, thanks again for being here and sharing all your knowledge with us and experiences.
Yeah, thanks for having me.
All right. Thank you.
Mm-hmm.